And this, again, the PPE is just going to be gloves. So, scenario C. Patient is a 56-year-old who suffered severe thermal burns on his left upper extremity while rescuing someone from a burning car. What a great job. All of his burns have healed, secondary to graft stroke. He is cooperative, but is hesitant to move his left upper extremity. So you have to be a little freedom. So I will have washed up and put on gloves. Then I'm going to come in, introduce myself, and say, hi, I'm Mrs. Sam, student physical therapist. Hi, nice to meet you. Is it okay if I go ahead and do some motions with you today, trying to get you move around, feel a little bit better? Sure. Okay.
Yeah, not really.
And I'm going to ask you for your pain levels, because if you're already hesitant, maybe you're fearful because of pain and your heart rate because you're anxious possibly about therapy, was my logic. So, are you in any pain today?
To keep his hand.
Oh no, you don't know able to work it. Yeah, are you in pain today or?
A little bit.
Okay. So I'd like to get an idea of how much pain you're in. So I'm going to give you a scale from 0 to 10, with 0 being no pain at all and 10 being the worst pain you could ever imagine. Where would you say you're at? Okay, so you can still work. Okay, if at any point you're in too much pain, just let me know and we won't proceed further. And the other thing I'd like to do is take your heart rate. Is that okay? Okay, so I'm just going to hold your wrist here for 30 seconds and then we'll start that too. Okay.
Kind of like a ducking, but my hand.
Okay, so my tasks with you are
So you're on the out.
passive range of motion, teaching a family. That's it. On left hand session.
I'm gonna close this.
Okay, so this is all just hand motions. Teaching a family has never had any hand motions, and then
Just like you're crossing.
long-term three-quarter supine positioning. Okay, so. Okay, hi, are you his aunt? Oh, okay, nice to meet you, Becky. Great. I'm going to show you how you can do some motions for Tom here, and so that whenever he gets tight or his hand or arm is hurting, you can kind of help him with that a little bit. Okay, great. So the first thing I want to show you is just how to move these bones in the middle of the hand around a little bit. So you're going to grab both sides of the hand, one of the thumbs in the palm, and just kind of move them back and forth and go to each of these little long bone hand bones here. Another thing that you can do is help move the fingers here. So you can actually curl them all around and just pull down a little bit. You want to make sure that you have a hold of the wrist here on either side, just so you're supporting the wrist. And then you can actually do the opposite motion by bending them back. How's that feel? Feels good, huh? Okay, great. Another thing that you can do for his thumb, because Tom's thumb's a little stiff, it seems like, is you can actually come in here and pull the thumb back. You want to hold either side of the wrist here, pull the thumb back, and you can push the thumb in. Okay? And you can do each of these motions about 10 times, 2 or 3 times a day maybe, whenever you guys have time, or if the joints are starting to hurt. Another option you have is to come in here and just bring the thumb in towards the palm, just right in here, and back out. You're still holding onto the wrist, kind of like I am here, to support the wrist. And another option is to bring the thumb all the way over to that pinky finger, and then back out. Does that feel good? Good. Lastly, you can come in here and just hold up above where this little long hand bone is, and above it too, and just move in and out with the thumb. Okay? Great. Okay, well, how was therapy today?
Good. That's easy.
Okay, well, what I want to do then is set you up in a long-term position so that you can be comfortable and rest and not have any pain, hopefully any more than what you already have. So then what we would do, since we don't have all the pillows for this, it's the left side of the patient that's affected, so we're doing a 3/4 supine or on back position. So effectively what we're going to do is we would put 2 pillows between the legs. Yeah, exactly. So I want you to roll over to your right side.
I'm gonna borrow this pillow real quick.
So, perfect. Okay, so we put 2 pillows between the legs, one stacked right on top of the other, and then we really want the patient to be extended back from the hip somewhat. Otherwise, what will happen is gravity will bring this upper leg back forward, so you want there to be a little bit of extension here at the hip. Another thing is, of course, the pillow that's under the patient's head. Then there should also be a pillow, you should have this hand down, I believe. And you want a towel roll underneath this hand to support the wrist. And lastly, if we had one more pillow, we would put that up underneath this left arm. And the arm would also have a towel roll right under the wrist as well. Yeah, wait, hands. Hands are holding towel rolls? It didn't show that in the picture.
Yeah, so
So
they're
you're gonna have 4 towel roll, or like a towel roll here, a towel roll here, a towel roll here, and a towel roll here.
that's why I joked in that like Facebook post about like how
Okay.
I mean you when in doubt just use more pillows and towels.
Contractors. So you're trying to keep the wrist from flexing too much and also the hand.
You want them in a local grip on the back.
Because
We'll
then
need a pillow up underneath here, we'll need a pillow, or a towel roll here.
Should more
and then a towel
pillows.
roll here. Okay, okay, very good. So that would be our long-term positioning. Except I wouldn't want you to scoot up, but yeah. It would be a little bit more beautiful.
cool.
All right, thanks for grabbing one.